everyone, and welcome back to my channel. My name is Brenna Jean, a future doctor, and today we're going to talk all about shadowing. Let's get started. So what is shadowing? Hopefully you all know this already, but as a quick explanation, shadowing is basically where you follow around someone in the healthcare profession, whether that's a nurse, a physician assistant, someone in the healthcare field that is doing something that you are interested in. So you get to follow them around, see the patients, most of them, and understand all of the inner workings of what it means to be in that field. It's truly a great opportunity to learn if a career in healthcare is great for you, and I highly encourage everyone to do some sort of shadowing at some point in their pre-med experience. I found shadowing to be a very beneficial experience. Now, I also scribed for a short period of time, and that was a great introduction to the world of healthcare because I was actually working in it, entering in notes to electronic medical records, all of that sort of thing. If you can't get a job while you're in school, which is a reality for a lot of people, you just don't have time, or you have to do a job that doesn't take up as many hours per week, then shadowing can be a great alternative to this. Not only can it expose you to the realities of healthcare, it can help you form a really good bond with a physician so that later down the line when you're trying to get letters of recommendation, see my video here, you already have a great relationship with a physician and it's a lot easier to get that letter. Now you might be wondering,
Brenna, how do I set up a shadowing experience? What if I don't know any doctors or I feel really awkward?
So there's lots of different ways that you can set up shadowing. The best way that I know of is using connections that you already have. So whether that's a pediatrician that you visited when you were younger, a current doctor, maybe one of your parent or guardian's physicians, or maybe you just have a family friend who works in healthcare. These are all great avenues to connect with someone who works as a physician and you can go and shadow them. I would also encourage you to look at alumni bases of your school, or if you're in a specific student organization that has alumni who are in healthcare, reach out to that alumni base and see if any of those people are in the area and would be willing to let you shadow them for a day. That's actually how I ended up shadowing a OBGYN in Ohio. She was an alum of a choral group that I was a part of. We connected at one of my performances and that's how I ended up shadowing her. That's the great thing about networking in general, honestly, is that having those one-on-one relationships with people can really help you later down the line. So even if it's a small 5-minute conversation with someone at an alumni dinner or a little, or an information session, that 5 minutes can get you that shadowing experience later on. Now, if you aren't really a part of an organization who has a good alumni base, or you're not really in a position where you know any doctors personally, that's okay. There's still opportunities for you. I would highly suggest going to your pre-med advising office, or if you have a center for career opportunities at your school, see if they can connect you with anyone who is in the healthcare space. That could be a great alternative. Or here's a hack of what I did. There's a few schools that I was interested in during the application process that required a letter from a DO. And I didn't know any DOs personally. So I reached out to their admissions office and said, hey, do you have any alumni in the Indianapolis area that I could reach out to? And they gave me a list of some of their recent alumni. I emailed all of the ones that I was interested in, so like a neurosurgery, a family med, a pediatrician, an OBGYN were among the few. And one of them, got back to me and we met up for coffee. She was just a resident, but she connected me with her attending at her residency program, and that's the woman that I ended up shadowing with in family medicine. So reach out to those schools, see if they have any alumni in the area, because that could be a really great opportunity to connect with current physicians. When it comes to actually crafting your message and asking someone if you can shadow, try and be as succinct as possible. Physicians and people in healthcare in general do not have lots of time on their hands, so you want to make good use of the time that they do see your email and not be, overly explanatory or anything like that. Make sure you are polite, right? So polite, succinct, Be very clear about what you are asking for. I would like to shadow, I would like to learn more about this, or even I would like a letter of recommendation after I shadow you. And then list the days and times that you are available, especially if you're in school or you are a working adult like me. It can be really hard to get those days off, so you need to make sure that your schedules can line up so that you can actually shadow and not miss anything important like an exam or a client meeting or something like that. If you do not already know this person on a personal level, be sure to include a resume or a link to your LinkedIn page so that they can learn a little bit more about you and see if you are someone that they would like to have in their office and exposed to their patients. Keep in mind, accepting someone into shadow means that they're putting the trust in you that you'll behave well in front of their patients and in their office. You need to be representing yourself well at all times throughout this communication. Now, what happens on the day of? You get to shadow, so make sure you're dressed business casual unless they say something different. You want to look very nice. I recommend bringing a water, something to write with, something to write on, and then any questions that you might have going into the day so that you can be prepared to get your questions answered while you're there. Now, while you are actually in the office, be very respectful. If you're going into an exam room where there are patients, don't say anything unless you're spoken to, because really you're just there to watch and the patient is wanting a good experience with their physician, and that can't necessarily happen if you're interrupting their story or distracting the physician in some way. The physician might ask you to help out with a simple procedure, especially if it's something that you will have seen a bunch throughout the course of the day. So definitely say yes to that. It's a great experience. You're not going to do anything where you're actually touching the patient. Don't worry about that. It'll be like you'll take something from the physician when they're doing that procedure, but it can be a really cool way to get involved. You might also get asked to see certain things. So if they're doing an exam of something or looking at a CT scan, you're going to get asked to look at it. So if you are worried about getting squeamish or fainting or something like that, just let the physician know. That way they're prepared in case you fall over. I did hear a story of someone who was shadowing surgery, and surgery is no small feat, and they actually passed out. So, just know yourself and don't be that person. If you know you might freak out a little bit when you see something a bit out of the ordinary, it's okay to say no to that, but just don't be that person. Be prepared to answer questions about yourself, especially if you told this physician that you'd like them to write you a letter of recommendation down the line. They're probably going to be asking you, so what are some things you're learning right now? Why do you want to be a doctor? What did you really like that you saw today? And it'll help them get to know you a little bit better. So just be prepared to answer those questions. And last but not least, don't forget to write a little summary down after the day is over, or after your 4 or 5 hours of shadowing is over. This can be really helpful later on when you're filling out your application or writing your personal statement, because especially if you're doing shadowing months in advance, it might be hard to remember some of that stuff. So jot it down, save it somewhere so that you can reference it later when you are going through the application process. All right, that's all I have for today. Hopefully I shared something that was helpful to you regarding getting shadowing experience, whether that's finding someone to shadow or knowing what to expect on the day of. As always, if you have any questions, let me know in the comments below. I will reply, or feel free to DM me on my Instagram at BrennaJFutureDoc. Otherwise, like this video if you liked what you saw today, and of course, subscribe to my channel to see more just like it. Thanks so much, and I'll see you next Monday. Bye.